Today, I'm going to talk to you about an interesting topic about exercise and pain. I'm one of the Stanford Pain Fellows. I'm finishing up in a couple of months, and I'm staying here as a faculty. So I don't have any financial disclosure to mention today. I'm hoping by the end of today, you're going to learn few things about health benefits from regular exercise. I will talk to you a little bit about the chronic pain, the definition and the etiology, and then we'll go over some theories about the mechanism of action, how exercise can help people with chronic pain. And then I'm going to show you some various type of exercise, briefly touch on adverse effect of exercise. Then I'm going to tell you what are the available evidence on exercise as a treatment for chronic pain. And then we'll wrap up with some recommendations for you. So first of all, I was thinking to make a poll and ask every one of you, regardless whether you have pain or you don't have pain, how much exercise you have. And this is one of the very important paper that was published back in 2018 in JAMA, one of the most prestigious journal in medicine. It's the Physical Activity Guidelines for Americans. And it's a very good paper, but it's basically what I choose here for you, that physical activity or physical exercise, regardless whether you have a pain or not, has plenty of advantage in your life. As you can see, the long list on the table and the left side of the screen, this is the adult, this is in children. You can have benefit in lowering the risk of cardiovascular disease, hypertension, type 2 diabetes, lipid, various type of cancer, improve cognition, reduce risk of dementia, reduce anxiety, depression, improve sleep, of course, weight loss, improve bone health, physical function, etc. When it comes to younger people, in children, for example, it even improves the bone health, the weight, and cardiovascular status. So whether you have pain or not, it is very important for you to exercise. And in the same paper, which is has a very nice summary, if you Google Executive Summary Physical Activity Guideline for American, second edition, there is a very nice summary that guides you what kind of exercise recommended for you based on your age. Even for pregnant women, there is some recommendation. So for example, this is just for adult, regardless whether they have pain or not. It is recommended that you at least spend 150 minutes per week doing moderate intensity aerobic activity. And I'm going to give you a few examples over this lecture. But again, anything, even walking, is very helpful. So I would highly encourage you to check out this very simple guidelines, a lot of nice illustrations that give you a proper instruction based on your age, gender, etc. So chronic pain, since this is what I do, first of all, what is chronic pain? Any pain that lasts more than 3 months, it should be 3 months at least. Some references say 6 months. That's a chronic pain. And the most recent updated definition for chronic pain Basically, it's an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. The reason why I brought this here, that sometimes you don't necessarily have an actual tissue damage to have chronic pain. Or sometimes it starts with actual tissue damage, but over time, the damage healed, and then you lift up with a pain. This is something called central sensitization. For example, what's basically mean that the person perceives sensation of pain after the period of recovery from acute injury. Let's say, for example, you have fracture to your ankle, then the fracture healed, whether by surgery, whether by cast or whatever. Then after 2-3 months, which is enough period for your fracture to heal, the patient still continue to have pain. This is a different concept, because now you have what the phenomena that called central sensitization. Of course, both local and systemic inflammatory respond during the acute phase, but also even the chronic phase. Many times we see systemic inflammation kind of respond, and that's very important concept, and which I'm going to touch base in the next few slides. So the peripheral nervous system become more likely to send pain signals to the central nervous system, while the brain and the spinal cord develop less inhibitory influence to minimize pain output. So basically, this balance between suppressing the pain sensation and perceiving the pain sensation get disturbed in chronic pain. So your brain will perceive more signals as you have a pain, we have a pain, regardless whether you have acute or pathology or not. It's important to know that the prevalence of chronic pain in the US adult, it varies, it's anywhere between 10 to 25%. But even if we decided to go with a 10%, think about that. If there is 100% watching this webinar today, then at least 10 of them, at least, they have chronic pain. So why we think exercise may help people with chronic pain? If you think about it for a second, and I had this question from my patient all the time, well, wait a minute, you are telling me to do exercise while my back is hurting. What you're talking about, I'm gonna cause more damage to my back. But here are a few theories why we think physical exercise is important. The first thing I already mentioned slightly, that people with chronic pain, they tend to have a lot of inflammatory mediators running in their system. So exercise reduce the pro-inflammatory cytokines and increase other anti-inflammatory cytokines to prevent something called hyperalgesia. What is hyperalgesia? Basically, it's an increased sensitivity to feeling pain and an extreme response to pain. The second theory, or the second mechanism, is exercise-induced analgesia. How is that? When you exercise, you trigger the release of endogenous opioid. Yes, surprisingly, our body has opioid. The opioid that we tend to take as a tramadol, oxycodone, we have opioid in our system. This is called endogenous opioid. So exercise can trigger the release of this opioid, so as if you are taking some opioid. So this is called exercise-induced analgesia. However, this might be dysfunctional in certain disease conditions, for example, fibromyalgia. Another mechanism of action, the effect of neurons and neurotransmitters. We know from our research that there is an imbalanced state and the centrally acting neurotransmitters like serotonin, dopamine, and norepinephrine. And when you exercise, the exercise triggers something called the stress response, which basically it releases and activate the neuroendocrine system that work in this balance again between these neurotransmitters. Another mechanism, the effect on the brain. So chronic pain patient often develop fear of movement ideas. The fancy word of this is kinesiophobia, where basically, because you have this experience, oh, when I walk, my back hurts, then by the time you develop this fear of movement kind of in your brain, so you avoid movement. So when you exercise, that can reshape or refocus or remap the region in your brain that is causing this fear. And that's called cortical reorganization. And of course, that goes back to the idea that you probably heard in another lectures about pain catastrophizing. So it helps reduce the pain catastrophizing, and it, if you think about it, it desensitizes your system on dealing with chronic pain. So now we spoke about a different mechanism of action why exercise can help with patient with or with individual who have chronic pain. Now, what are the type of exercise that are available to us? First of all, we have just a simple standard endurance training like running, swimming, hiking, walking. Very simple thing. All of us we can do it. And then the strength training, for example, weightlifting or any activities that involve resistance kind of movement. Then you have something called high intensity interval training, where basically for intermittent type period, you have increased intensity of activity that will incorporate a sustained aerobic workout. Then we have the dynamic flexibility training that you probably all of you have seen or done at some point, like yoga, Tai Chi, and all these type of flexibility kind of training. So for example, yoga, the definition of yoga is a practice of breathing, mindfulness, spiritually, body, and connection among these factors. So through this three main component, the posture, breathing, meditation, your health overall will get better, and you can help your chronic pain. As you see, there are multiple positions that you can do. And some of them might be painful for your condition. For example, I don't imagine myself doing this, but maybe people are more flexible. So, and I'm going to talk about how you individualize your exercise at the end of my presentation. But as you can imagine, there are some exercises, for example, if you have a lower back pain, you might not be able to do it. Then Tai Chi is mainly, it's like mind-body exercise. It's like a dance-like movement with mindfulness thing. Slightly, or it's different from the yoga thing, but it's mostly all of them like stretching, mindfulness kind of exercises. Then we have the mixed strength and aerobic training, like the CrossFit, for example, or the body pump. This is more like include weightlifting, more like working in a certain muscle group and training certain muscle group for certain pain conditions. Then you have the functional fitness training, which is probably all of us have done or doing in a daily basis. And this is important to exercise various muscles in your body and emphasizing the core stability. So then the question, is there any side effect for physical exercise? And the answer is yes. And the simple way you can think about it as if you're taking any medicine, the medicine you take, it requires you to reach a certain dose until you have a benefit. And if you exceed that dose, then you might have some side effect. You might have some complication. So think about exercise in the same way. When you start exercise and when you start physical therapy, don't expect that from this first session, you will have that magic kind of pain. And then you might want to take it easy just to avoid the side effect. When you notice side effect, you might take a step back just to where your comfort zone ends, then you'll start again. It's very similar concept when your pain doc give you a medicine, for example, gabapentin, very common medication, and say, start slowly, start gradually, and then increase it until either you have an experience, pain relief, or you have side effects, then we will readjust. So maybe in certain people, when you start, it can flare up your symptoms, especially if you overdo it, or if you do something that you may not necessarily want to do. And of course, we don't remember that it's a physical stress. So if you have a heart disease, coronary artery disease, if you have some respiratory disease, if you have COPD, for example, it's important to be thoughtful about how much stress you're going to put in your heart and your lung, which I just mentioned. So how we should do this? Before that, let me tell you about what are the kind of evidence we have. Do we have evidence to recommend this to individual with chronic pain or not? So this is a very recent, so Cochrane Library, first of all, is one of the most prestigious in the medicine field, where they review researches and they came up with summary and guidelines. So, for example, this is a systematic review, meta-analysis that was most recently updated in February 2020. And they looked at the physical activity and exercise for chronic pain in adult. They looked at different things. So basically, they included 381 studies with more than 37,000 participants. Very huge review. And there was studies that looked at exercise, variable kind of exercise, including aerobic exercise, strength, flexibility, range of motion, yoga, tai chi, and they studied that in multiple chronic pain conditions, including fibromyalgia, low back pain, osteoarthritis. And then what they found out that overall, the evidence, which I'm going to share with you in the next few slides, it's low to intermediate quality. And the only reason why is that because these studies that were included, they have a small sample size, which, as you imagine, it's hard to do a study with this thing because it's hard to randomize the patient. It's hard to blind the patient. I mean, I can't tell you go to the group that you don't do exercise or go to the group you do exercise. So it's a challenging studies to do. However, they did a very good job. And what they found in terms of pain severity, that overall the evidence favor that exercise may reduce the pain severity. And here we are talking about pain scores. When your pain doc asks you, what's your pain score from 0 to 10? That's what we are looking at. However, it's important to recognize that the effect here is not surprising. It's not big effect. So for example, if your pain, let's say 8 over 10, I wouldn't expect that physical exercise will necessarily reduce that to half within a few days. You might have some flare at the beginning, then things get better and better and better. Eventually, things will get better. However, and then I'm going to touch about this at the end of my lecture. Here in Stanford pain clinic, we always talk about the multidisciplinary pain approach, where we recommend to the patient physical therapy, pain psychology, some medication, and some procedures. And our goal that all of them together, when you put them all together, they give you that significant pain relief. What's more important, though, than pain scores, which I really want to encourage all my patients to think about this, is the physical function. The pain score, if you think about it, if your pain score is, if you say your pain score is 3, might mean 8 for someone else and vice versa. But what is more important to measure is your physical activity, because that is very similar between people. If you're telling me I'm able to walk for a block, everyone knows what does it mean, what walk for a block. But pain score 5 for you, maybe it's different for 5 for me. So here is where most of the evidence shows that physical exercise significantly improve your physical function. And the effect size for that is very good. So if you think about that, even if you don't notice significant relief in your pain scores, but look at this, you're most likely will have improvement in your physical function. You will be able to do more stuff. Psychological function, the evidence also favor that exercise will improve your psychological function, or at least there is no difference. But there is no single study showed that physical exercise has a negative effect in your psychological function. In terms of adverse effect, and we're still talking about the same study here. So most reported side effect was soreness or increase in muscle pain immediately after starting the exercise. But again, I want to always remind you with the example of taking a pill for pain, taking gabapentin for pain. If you have more side effect, just go down on that. If you are tolerating it, go up on that. Same concept here. So if you started that, maybe just you started more than you should start with. You have some soreness. Okay, take a break, then start doing it again. As you see, there is very rare serious side effect. So if you think about it, it's safer to do this than taking, for example, an oxycodone pill. You might feel better when you take an oxycodone pill for the first time, but eventually you expose yourself to more risk and you don't necessarily improve your function. While by doing this, overall you have way less side effect and there is a better chance you improve your function. So here is my recommendation at the end. Exercise has a distinct place in the multimodal treatment of most conditions associated with chronic pain. Even if direct benefit of exercise may be small, indirect benefit of exercise, such as cardiovascular fitness, decrease your BMI, sense of well-being overall, significant contributor to reduce disability in a variety of disease, including, of course, chronic pain. Any exercise program, any exercise should begin with individual assessment. So when you go to your physical therapist, they're gonna do some examination and they're gonna individualize this for you. It's like exactly the same pill or the same gabapentin I was always telling you. I might give this patient, for example, this amount of dose to start with, but the other patient, I will give them different dose. And this is the same thing I want you to think about physical exercise and physical therapy. So individual assessment, and then we'll go from there. In general, exercise must target flexibility, muscle strength, core stability, cardiovascular fitness, and gait steadiness. During exercise, individuals with more distress, fear avoidance, catastrophizing, low mood, and low self-efficiency will benefit from higher level of supervision. So if you belong to this group, you might benefit more from more supervision when you start with doing this kind of exercises. Reassurance that tissue are structurally sound can be helpful, and de-emphasizing pain assessment can reduce unhealthy hypervigilance. Individuals with chronic pain should have as much control as possible in choosing their exercise mode. And that goes to the previous slide. So for example, if you enjoy doing Tai Chi more than yoga, then that's fine, do Tai Chi. I'm not gonna force you to do this versus this. It's basically what you like, what you enjoy, and what work best for yourself. And then I will not forget to mention about cognitive behavioral therapy. Part of the series that you are watching, there are some lectures that cover that part, but most of the studies show that if you combine cognitive behavioral therapy with physical therapy, they are way more helpful than each one by itself. So the combination of that. And that's also came to the point why here in our clinic, we really like to send our patient, okay, to the pain psychology, so they start to have some cognitive behavioral therapy, and then physical therapy, some medication. So all of them work together, and you have a better outcome. And remember, at the end of the day, any amount of movement is preferable to none. If you are not able to run, but you can walk, please walk. Anything is better than none. That's a very important role. Exercise, at the end of the day, shouldn't replace other modalities. Some patient may need surgery. Some patient may need some injections. Some patient may need medication. But again, I almost always put exercise part of any treatment plan for any of my patients. That was just my brief overview about exercise and pain. Thank you for your attendance. And I hope you find this helpful.